Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Vijay, shekar, a cardiologist and electrophysiologist from Apollo Hospitals, Trichy. So today we are about to discuss a very growing problem in India, that is how to identify and treat and combat heart failure. Many of us would have heard about heart attacks, but now there is an increasing prevalence of heart failure. So we will just see what heart failure means. So when a doctor tells you that you have heart failure, what does it actually mean? So to get into that, we have to understand what the heart function does to us. The heart is basically an electromechanical pump. So the work of the heart is to pump blood effectively to all parts of the body. And when the heart, for some reason, is unable to pump blood to the vital organs of the body, and that is a condition we term it as heart failure. So how do we assess whether our heart is pumping normally or not? There is a particular parameter that we can assess by an echocardiography. We call it as the ejection fraction, or EF. So the normal ejection fraction is around 50 to 70%. And whenever you get an echo done, and if this number is lower than that, then probably there is some problem with your heart pumping capacity, and that means you are developing a heart failure. So second is that most commonly patients ask us, how do we recognize, doctor, whether we are in heart failure? What are the symptoms of heart failure? So generally, the most common symptom of heart failure is a shortness of breath that is commonly associated whenever you walk or whenever you climb a stairs, whenever you try to run or whenever you try to exert yourself, you may have a shortness of breath. That is the most common symptom. Apart from that, people may have sometimes swelling of the legs, and then they may have some swelling of the abdomen as well, and sometimes extreme fatigue, loss of appetite, and loss of weight. All these also can be signs of heart failure. Many times a common symptom that is overlooked and can be a symptom of heart failure is cough, especially when a person has cough on lying down. It could be a very early symptom of heart failure and hence should not be ignored. So the next thing people ask me is, are we Indians more prone to develop heart failure? The answer is unfortunately yes. The reason being, many of our Indian population have higher incidence of hypertension, diabetes, overweight, or obesity, and these are probably the risk factors for heart failure as well. So that is why heart failure is increasingly common in the Indian population. So how do we recognize heart failure, or how do we confirm heart failure, is the next thing we are going to discuss. So usually heart failure is diagnosed by a battery of investigations. The most common investigation that is done in order to recognize or confirm the presence of heart failure is the echocardiogram. The echocardiogram usually it gives you information about how effectively the heart muscle is functioning in terms of ejection fraction that I have previously discussed. And then it also gives you information about how the heart valves are functioning, and also some indirect information about how the blood circulation to the heart is. So echocardiogram is an important investigation. Apart from that, we do order blood investigations again to confirm or rule out the presence or absence of heart failure. So then, is heart failure death sentence? Is sometimes people ask me, sir, I have been diagnosed with heart failure. Is there anything I can do about it to come out of it? The answer is yes. Most of the times, heart failure can be treated effectively, and the outcome of the heart failure will depend upon what the underlying cause of heart failure is. So majority of the time, the doctor prescribes you certain medications to improve the pumping capacity of the heart. We call it as the heart failure medications. And apart from that, based upon the reason why the heart muscle has failed, there are again a host of treatment options ranging from angioplasty, bypass surgery, to, if it were to be a valve related problem, we can undergo a valve surgery. And even if these are not treatment options, we have something like pacemaker implantation. We call it as a cardiac desynchronization therapy. And these are all the options that are available for heart failure treatment. So heart failure definitely is not a death sentence. there are a lot of treatment options available for heart failure. If appropriate treatment is being considered and given, patients do really well in spite of having severe heart failure symptoms. So the thing is, always prevention is better than cure. So how do I prevent heart failure? Yes, basic things are basic. So one thing is you have to exercise every day, at least 30 to 40 minutes per day. And again, dietary adjustments and modifications are a must, especially in patients who have developed heart failure. Fluid restriction is a very important thing. And again, salt restricted diet is an important component of the diet. And again, keeping yourself regular on medications, and again, keeping yourself on regular follow-ups with your physician will help keep your heart failure symptoms under control. And again, quitting alcohol, tobacco, as well as other forms of addictions will also help improve the heart failure symptoms and to a great extent prevent the development of heart failure as well. So thank you all for listening to the podcast, and let us make in India a heart failure free country. Thank you.